We've come a very long way in the management of mantle cell lymphoma. Not too long ago, the average survival was somewhere around 5 years, and currently many patients who complete aggressive induction therapy, potentially followed by transplant, can enjoy a progression-free survival of 8 to 10 years or longer. In addition, we now have significantly improved the outcomes for patients with relapse disease with the BTK inhibitors, as well as with CAR T therapy, and there are a number of new therapies that are under development. In my mind, however, there are still some unmet needs for patients with mantle cell lymphoma. One particularly challenging clinical scenario are those patients who have progressed after a CAR T therapy. In my own experience, those patients don't always have the best treatment options and don't frequently respond for a long period of time to subsequent therapies. And so I hope that future studies will be geared towards this high-risk group of patients. Similarly, another high-risk group of patients are those who experience early disease progression after their initial therapy. So I just mentioned that some patients will experience 8 to 10 years of remission, but for patients who stay in remission for only 6 to 12 months, we know that their prognosis has unfortunately been poor. And those patients don't always respond as well to second-line and beyond therapy. And so those are the two groups, the early progressors and those who progress after CAR T, where I think additional study is needed to improve the outcomes for those patients.